Time for the podcast version of the Medical Minute, and thanks for listening. I'm Mike McConnell, and my guest this time through is going to be Dr. Chris Zammit. We're talking neurological care. Dr. Zammit is a medical director for stroke and neurosciences and the ICU at Good Samaritan Hospital. Been here once before, and Dr. Chris Zammit, good to have you back. Thanks for your time.
Absolutely. Thanks for having me.
We're talking strokes, and it's interesting. Some years back, I remember watching a teaser for a news story on TV, why it's important to go to the hospital when you think you're having a stroke. And I said to myself, who doesn't know that's important? But apparently there are people out there who might put it off or perhaps thinking it's something other than a stroke. Does that happen?
Yeah, Mike. Unfortunately, it happens. It happens a lot. The hard part, I think, with stroke and really having people have that sense of urgency once they have those symptoms is that stroke it doesn't come in one clear set of symptoms. There's a lot of different symptoms that someone can be having that cause a stroke, and some of those symptoms that cause a stroke, it could be something else, and sometimes that something else is something that is benign. But when it is related to a stroke, if it's left untreated, it can lead to a permanent disability. And the difficult part about stroke is that there's such a short time window that we have to act to reverse or reduce the possibility of that disability becoming permanent.
Sure.
So yes, it is a common challenge, and it's the most common reason that folks who are having a stroke, when they do present to the hospital, are not eligible for our acute treatments we can provide. Is that they present in a delayed fashion. So that's certainly something we want to get out to the community.
Sure. Well, Good Sam TriHealth. Good Sam has been designated a comprehensive stroke center by the Joint Commission. What does that mean to me?
Sure. Okay. Yeah. Well, if you don't mind, I kind of want to explain a little bit the certifications that are available for stroke centers.
Sure.
Fortunately, over the past 10, 15 years or so, a lot of hospitals have made themselves ready to take care of some types of stroke patients when they're brought in. And there's over 4 different levels of certification. There's an acute stroke ready certification, where those hospitals can start one medication called TPA that helps to break up blood clots that may be blocking blood flow to part of the brain. There's a primary stroke center where if that can treat patients who have received TPA and admit them to the hospital and do further tests to know why they had a stroke and to help identify what they need to do to help reduce the risk of another stroke. Then there's something called a thrombectomy-capable center. And this is where 5 or 6 years ago, we identified that there's some stroke patients who have a blockage of a very large blood vessel who can be treated with a surgical procedure to emergently open up that large blood vessel that's been suddenly blocked.
Okay.
And then the highest level certification is a comprehensive stroke center. And these are centers that can do everything I just said, give TPA, do all the tests that are needed to identify why somebody might have had a stroke, identify what therapies they need to be on to help prevent another stroke, surgically open up suddenly blocked blood vessels that can help patients improve from their stroke. But then also there's 15% of strokes are due to bleeding into the brain, and that can be due to various problems with blood vessels in the brain. A comprehensive stroke center has all the resources available, from a neuro-intensive care unit to cerebrovascular neurosurgeons to neurologists and all the advanced imaging that are needed to care for someone who has any type of stroke, no matter how complex, whether it's due to a blocked blood vessel or bleeding in the brain. And so Good Samaritan Hospital is one of 2 in the Southwest Ohio region, so the Southwest Ohio, Northern Kentucky, Western Indiana region that is a certified comprehensive stroke center.
Okay, that's good to know. So the emergency room, they're prepared for you when you get there?
Yes, yeah. Some of the biggest things we have to decide or make sure we're ready to do for folks who come in with a stroke nowadays is we need to be able to perform advanced imaging of the brain for some types of strokes to decide if some of these therapies could help someone. About 5-6 years ago, stroke was largely driven by if someone came in in a certain time frame from the onset of their symptoms, that was a very strict time frame when they could be eligible for treatment. Now, there are some patients who present a bit later or when they first wake up in the morning and we don't know when their stroke started, that we can get some more advanced imaging performed of the brain, which can show us, well, is there brain tissue that's already been irreversibly lost and we can't undo that, as compared to some brain tissue that might have low blood flow to it, and it's that low blood flow is preventing that part of the brain from working. But if we're able to restore the blood flow to that area of the brain, we can then save it. We can bring it back and have it begin to work again. And Good Samaritan Hospital has all those access to those imaging, and it has access to the right specialists,
right,
and to have 24/7 neurocritical care access to take care of all of the most severe and complex strokes that can come in any time of day.
All right, so what are some of the symptoms that people should be aware of? I know slurred speech would be one, maybe numbness, but run them down for me.
Of course. Yeah, actually, there's a pretty helpful acronym for this called B FAST. So B stands for balance. So if you suddenly feel that you're off balance, that you can't walk straight, and the E is for eyes. So if you have a sudden loss of vision or double vision, F is for face. So that's where if your face is drooped on one side. A is for arm. So if your arm feels weak or numb, it's not working right. And S is for speech. And the speech piece is important because there's a couple of different ways to think about that. There's someone's speech could be garbled. Someone could not be able to say the words they want to say, or they could not understand the words that are being said to them. Another one, actually, I would add to that, too, is if someone suddenly isn't as alert or responsive as they normally are, would be another symptom that I would say, get them evaluated right away for possible stroke-like symptoms. And the T in that be fast is time. It's that as soon as you recognize any of these things, just get to the hospital very quickly and get evaluated for to make sure that you're not having a stroke, and to give us the ample opportunity to get you therapies that will give you the best chance to recover if you are.
And the consequences of putting it off, I guess, it just increases the chances that your issues may be permanent.
That's right. Yeah, there's really just a 15-minute delay. 15 minutes decreases the possibility of someone recovering to be able to be at home. It decreases the possibility of their being able to walk again on their own. And also, every 15-minute delay increases the complications of any treatment we provide. The biggest complication of our treatments when we're trying to restore blood flow to the brain is causing bleeding into the brain. You see, most strokes, 87% of them, are due to the sudden blockage of blood flow to a certain particular portion of the brain. And the longer that blood flow is blocked, the more likely that brain can't be saved. And if it reaches a point where that brain definitely can't be saved, but we've restored blood flow to it, it can cause that injured brain to bleed. So again, just 15-minute difference is a difference for folks between giving them the best chance to be able to return home, to be able to walk again on their own, and to reduce the possibility of a complication of treatment.
And you say it's important to call 911, I guess, as opposed to having somebody drive you, or certainly driving yourself, because some degree of care can begin in an ambulance.
That's a great question. Thank you for bringing that up. I can't emphasize enough the importance of calling 911. It's very understandable that someone's instincts may be to want to just jump in the car and get to the hospital. But from that moment that the ambulance arrives at your house, they're already collecting information, and they're able to relay information to the hospital that allows us to mobilize resources even before you return there. There's not a way for somebody driving by a private vehicle to do that. Plus, the way the ambulance enters any emergency department puts you immediately into a portal that accelerates your evaluation. So yes, absolutely. If you're having these symptoms, do not drive to the hospital. Call 911. It gets everything moving much faster for you.
Sure. Speaking again with Dr. Chris Zammit, Medical Director for Stroke and Neurosciences at Good Samaritan Hospital. It is the TriHealth Medical Minute podcast, and let's talk about prevention overall. You're a neurocritical care doctor. Explain exactly what that means to me.
Yeah, of course. It is a mouthful, isn't it?
Yeah.
So within medicine, there's various kinds of what are called intensivists or critical care physicians who take care of patients in intensive care units. And intensive care units are at this point subspecialized. That within hospitals, you have pediatric intensive care units, you have trauma units, you have surgical units, you have cardiac units, and now, particularly where there's a comprehensive stroke center, there are neurocritical care units or neuroscience intensive care units. And those are staffed by neurocritical care physicians who have completed their initial residency training and one of a couple of different specialties, but then they have other specialized training in critical care as well as the neurosciences. And particularly the training and the certification is ensuring expertise and competency in caring for patients with severe brain or spinal cord injuries or even other ailments of the nervous system. So it can be anything from certain diseases like myasthenia gravis to tumors of the brain or spinal cord, to severe trauma, to patients who have intractable seizures, which is called status epilepticus, and of course, severe strokes will all be taken care of in a neuroscience intensive care unit by neurocritical care physicians.
Then I would guess maybe working with patients, it would depend to what degree they can communicate with the doctor to begin with.
Yeah, we as a neurocritical care physician, actually, we certainly spend a lot of time communicating with families. Very often when someone comes into a neurointensive care unit, the patient, they of themselves they have some impairment in their ability to communicate and to even at that time comprehend what they're going through. So, yes, a lot of our time is spent speaking with the loved ones of our patients to keep them updated on what is going on, what their prognosis is, what the treatments are that we're going to do, and helping to make important decisions for their care and for their long-term prospects.
So what would be some general lifestyle choices you should make to avoid a stroke?
Oh, yes. So, I mean, some of them are I think I hope everyone knows. Obviously, avoiding some behaviors that have well established to increase your risk of stroke. Smoking being a huge one. Heavy alcohol consumption. So really having really more than 2 or more drinks every day would not be a good idea. Of course, having a healthy diet. The best diet nowadays for folks to focus on is a Mediterranean diet, which is rich with fish, olives, more of your olive oils type of things, and more multigrains rather than some of the simple starches when it comes to carbohydrates. Exercise is certainly helpful. Exercising at least 3, if not 5 days a week, particularly if it can be vigorous exercise. Some gentle exercise is nice, going for a long walk or whatnot, but incorporating some vigorous exercise is also very helpful in reducing your risk of stroke. Making sure that you have a primary care physician that you're seeing on a regular basis. Blood pressure management is extremely important. If you have elevated blood pressure, taking measures to have your blood pressure optimized. If you're of a certain age, having your cholesterol checked and being on cholesterol-lowering medications and a cholesterol-friendly diet are all very important for it. And then as we age, there are some things to check and monitor our heart health, again, which can be coordinated through your primary care physician to identify certain conditions that can increase your risk of stroke. I really can't emphasize the blood pressure part enough. There are some recent studies that have shown that those who monitor the blood pressure more closely, and particularly now trying to achieve a blood pressure that's more on the order of less than 130 over about 80, 85, bring you to the point of having the lowest risk of having a stroke. the high blood pressure is typically defined as a systolic, a high number of greater than 140, or the low number greater than 90. But recent studies have said that actually, if we can have a lot of patients have their blood pressure below 130, and again that low number around 80, we can provide them with the lowest possible risk of a stroke.
Yeah. Then how do you diagnose somebody presents themselves at the emergency room, believe they're having a stroke? How do you determine what type of stroke that they might be suffering from, and how long does it take to make that determination?
Yeah, it's a great question. Some strokes are quite obvious. So the symptomatology as a patient has when they come in make it very clear that someone is having a stroke. Other times it's less clear. Most times in the less clear situations, that started out by getting some imaging of the brain, which usually starts with a CAT scan of the brain. And another type of imaging that we're focusing on getting for really all of our stroke patients is something called angiography, CAT scan angiography. And that's where we put some contrast into the blood, which eventually gets removed from the body by the kidneys. But then the CAT scan can then show us all the blood flow that begins from the upper chest all the way through the neck up through the brain. And since, again, 87% of strokes are due to a restriction or blockage of that blood flow, that helps us identify any problems in those blood vessels that could propel us to either emergently open them up surgically or provide medical treatments to stabilize and even reverse what's been happening with those blood vessels.
Okay.
Ultimately, an MRI is very commonly performed, which uses a strong magnet to look at the brain tissue itself and how well it's working in certain areas to highlight if there is or is not a stroke. But the emergent evaluation involves CAT scans, whereas in the first couple of days, oftentimes we'll also seek to perform an MRI to look at the brain tissue itself.
Sure. Well, then post-stroke, someone comes through it successfully. What services does TriHealth have to help people with rehabilitation or whatever after the stroke?
Oh, yes. So great question. And this is actually can be one of the more challenging parts of the journey for a patient and the family who have had a stroke. There's medical services and then there's support services as well as rehabilitative services. So, as we talked about, once somebody has had a stroke, one of our major priorities is to help prevent them from having another one. And so there's many, many different causes of a stroke. And what we need to have done are different tests to see if there's another condition that needs to be managed to reduce the possibility of that stroke. And some strokes can come from problems with the heart. So we would have them work with some of the folks from our Heart Institute to either guide medical therapies or sometimes even surgical treatments of issues with the heart that can increase the risk of stroke. There's some conditions that cause the blood to clot abnormally, and even some cancers increase the risk of stroke. So we have our hematologists and our oncologists at TriHealth that we work with closely in cases of that nature. Some conditions are due to inflammatory conditions of the blood vessels, and that's where we work with our rheumatology specialists. For those who have other risk factor conditions like significant diabetes, we have our endocrinologists that we work with from a medical standpoint. And then also if there's any surgical problems with the blood vessels, we would have you either work with our partners at Mayfield Brain and Spine, where there's 3 cerebrovascular neurosurgeons. But we also have our vascular surgery team at TriHealth, who can particularly specialize on some problems with the carotid arteries or even of the aorta or other blood vessels that are in the upper chest that can increase the risk for a stroke.
All right.
Now, besides the medical specialties, there's the rehabilitative specialties. Some folks who have had a stroke will qualify for an inpatient stay in a rehab. TriHealth, within the TriHealth system, we have the TriHealth Rehab Hospital, which is located on Dana Avenue over near Norwood. And sometimes folks will have a stay there that can be anywhere from 1 to 3.5 weeks or so right after their stroke to give them some intense rehab, which is at least 3 hours a day, to try to help them accelerate the recovery to go home. Some folks, we can go home directly from the hospital and they can do outpatient rehab. And within TriHealth, we have a program called PROS, P-R-O-S. And we have that program at Good Samaritan Hospital, and then also up it's called the Pavilion up on Pfeiffer Road near Bethesda North Hospital. In addition to some other outpatient services for physical therapy, occupational therapy, and speech therapy that are down in our Western Ridge region and up near Arrow Springs as well, and even up near the Butler Hospital to help folks with their recovery.
Okay.
I think another thing that you have to think about when it comes to stroke recovery is that this does change a patient and their family's financial status a lot of times. The person may have been bringing in a significant amount of income, and so I certainly would consider having anyone who's struggling with any of the navigating some of those features to work with our social workers, care coordinators, and financial counselors to ensure that they've done everything that they've applied for everything that's available to them to bridge those gaps, because that is a significant implication of strokes for a lot of families.
Sure.
And the individuals themselves.
Well, we've covered a lot of ground here, and I certainly appreciate your time. My guest again has been Dr. Chris Zammit, who's the medical director for stroke in the Neuroscience ICU at Good Samaritan Hospital. And it's a pleasure as always, and it's obviously something people have to take seriously. If you think you might be going through symptoms of a stroke, you call 911 and get it checked out. So we can get more information, by the way, visiting TriHealth.com/stroke, TriHealth.com/stroke. And again, Dr. Chris Zammit, thanks for your time today.
Oh, no, thank you for taking the time to help us get this information out to our community and empowering everyone to do what they can to reduce the risk of stroke and to get to the hospital immediately if you have any symptoms of a stroke, because we really want to minimize and prevent any disability related to stroke as much as possible for our community.
No doubt about that.
Thank you.
You bet. And thanks for listening to the TriHealth Medical Minute on 700WLW.com.